Now we've got Q&A for 25 minutes or so. So we could, this gentleman here, first of all. Nope.
Thank you. That was a really interesting discussion. My name is Michael Green. I'm Cabinet Member for Health and Wellbeing at Lancashire County Council, so the fourth largest council in the country. Unfortunately, we weren't successful in receiving government funding in the first wave, but I'm pleased to say that we actually launched our Family Hubs network last week. So we opened 12 centres right across the county from Monday to Friday of last week, and are very keen on this as a way of moving forward with this, and would welcome some further dialogue in how we can take these forward. But I'm also wondering whether there's any way that there will be any further government assistance in terms of funding moving forward, because it's an agenda that we are keen on supporting the government on, because we see it as a way forward to make a real difference in terms of the best starting life for children moving up to the age of 19 and beyond for people with special needs.
Great.
Thank you.
Thank you. Minister?
Well, look, well done on setting one up. And it was great. It was great to hear that from Catherine as well. Look, our aim is to have them in every single area. There is no imminent plan for another wave of them. We're trying to get this 75 up and running, and they are all doing they're pretty much on course. There's a sort of small handful we're pushing a bit, but they're pretty much on course. So nothing I can tell you right now, but certainly the aim is to have them all over the countrywide.
Okay.
And we want the evaluations as well, don't we, David?
We do, yeah, we do want the evaluations, and I think, look, a lot of what we're doing is slightly to digress, but we're doing family hubs, we're reforming the special educational needs and alternative provision system, we're reforming the children's social care system. We're making a big change in the childcare entitlement and so on. And with each of them, we're sort of testing and learning. So actually doing half the areas in the country is much bigger than most of the testing we're doing for some other programs. I'm sorry, you didn't get one. I wasn't party to the scoring, though I know it was quite rigid. But yes, we do want to know that they work as well.
Emily Frith from Adoption UK. Family hubs were established because of the really strong evidence about the importance of family and early attachment. Adopted children often have really difficult early starts in life. I was speaking to an adopted person this week who told me that he'd met his third mother at the age of 4 weeks. So it's really, really important we get this right for adopted children and other care experienced children. One of my concerns about family hubs is that when you are adopting, you may not get the child in the family until they're aged 3 or 4, maybe even later. And that can be the same for kinship carers or foster carers. They may not go for the early years support in a community. They might not go to the baby events at the library. So it's really important we can think of other ways of reaching out to families in those situations. They also might feel stigmatised by some of the challenging behaviour that children who are traumatised may display. So would the panel agree that it would be useful for family hubs to have specialist work or other ways of connecting into regional adoption agencies or local authorities, care experience professionals to have that expertise within the hubs?
I could start just a quick one, just to say I completely agree. There is expertise out there with supporting parents, newly adopted parents. Sadly, it's fairly sort of small expertise from what I understand as well. And somehow we need to grow that. And I think it's brave of the government actually to say, yeah, we want to look at parenting. But there are some fantastic research studies and research models which can really help with what good parenting looks like. And that applies to any child, whether they're adopted or not. So seeing that embedded within a family hub, I think, will be absolutely crucial. I think Catherine might have more.
Thank you. Yeah, absolutely. I think this is one of the reasons why it's so important that family hubs is 0 to 19 and 25%. because you never know when you're going to encounter challenges with children and in your parenting, and therefore we need a seamless transition between the different stages of parenting so that you can keep on going back to the family hub and get the help at the right time. When you say connecting with specialist services, the one thing I would add is that obviously, hopefully this came across from the panel as a whole, is that Family Hub policy, Family Hub networks, when it works best, is about that connectedness. So it's about connecting people to the right services and support. And if you go into a family hub, one of the things you need is not just a relational culture, but people working there who have a knowledge, an extensive knowledge of what is out there in the local community, but also nationally. I mean, obviously post-COVID, we've seen, because of that digital engagement, we've seen far more local charities delivering services in different parts of the country as they can through online delivery. So I know, for example, there's a small charity that specialises in children with ADHD, and the lady who runs it is now working with families all across England and beyond. And the other point I'd like to make, which connects to Lancashire, is that some of the best family hub implementation is where they've really thought through the connectedness. How do we make this work? It's not just a one-off, let's count up everyone who's out there, because the services, the people are always changing. You need a system, and Lancashire has got a great approach. So if anyone wants to learn how to do that, do speak to Lancashire.
Sorry, and can I just add as well? I think you make a very good point, because one of the other areas, looking at this from a family court lens as well, is special guardianship orders. And I know, because we've had quite a few SGOs through our charity, there's not enough support for the SGOs at all. So I think that's a really important point about linking the family hubs, because the family can be quite big, and it's the extended family. Sometimes grandparents become the main caregivers. So I think your point is well made.
Lady in green. Oh.
Thank you. I'm a GP from Wolverhampton and also the safeguarding lead for our group of practices. So I've seen firsthand the advantages of the 0 to 19 hubs. They're a fantastic resource that we have, and we feel privileged to have them. The only concern I have is the children we see who aren't attending school for whatever reason. So we have a lot of travelling families, also the children of migrant families who are yet to be placed or haven't been given a school that's appropriate, so they're waiting to be placed. I feel that those children are very vulnerable and also seem to be invisible to a lot of services unless they self-present to a service. They don't really have access to those services. So I guess I would like to see sort of greater provision to ensure that children who aren't in education, there is a deadline, in want of a better word, for those children to be to have an appropriate placement, to be put in the education system, but also more support for families who find it difficult because of language barriers or social barriers to access those services and self-present.
Thank you. Well, Minister, perhaps, you're the Minister of Children. There are quite a few children that seem to disappear through cracks. In this case, what's your thinking on that?
Well, look, let me just say something about both. I think, I don't know whether it's by having a dedicated worker, but I certainly think that family hubs should absolutely be well connected to adoption services, foster services, kinship services, because going back to what I said in my introduction, of course we want children to be able to stay with their families where they can, but it isn't possible in some cases. And we need more of all those things. We need more foster carers. We need more people who will adopt. There's a good thing that's just launched in the Northeast, Foster Northeast. 12 authorities have all come together to try and increase the number of people who get to the point of fostering, because we get lots of inquiries and very few people then end up doing it, as you know, and we've got to try and sort those issues. On your point, again, I think this is where we want, we're trying not to be too prescriptive about what each family hub does, and I think that's been a strength, because as you heard from Catherine, each one is approaching things in a different way. But again, I think that where family hubs do recognise that's a need in their area, that is something that they should be supporting. But by the way, not just, as you say, sort of traveller children and migrant children but also the children who post-COVID have not gone back to school. And I've been having that conversation with a lot of people because, again, if we're going to solve that, we cannot solve it without knowing what's going on in the family and trying to support what's helping in the family. So not just for those groups, the broader issue of non-attendance we've got to try and cover.
You were wanting a question earlier on.
Hi, I'm Ava Berry from the National Children's Bureau. I'm a policy manager there. We're very much in favour of the Family Hubs initiative. We think it's brilliant, but we're quite concerned about the workforce shortages across much of the children's sector, and we'd just be keen to hear from the panel what some of the solutions could be to improve that.
Workforce shortages.
You go first. Okay.
Do you want to go first?
Yeah.
Okay. Oh.
Yes, I think it's been very interesting watching how local authorities have developed the teams that they need for their family hubs. And this has led to lots of new job specifications and lots of a big push for recruitment. And of course, as you say, they're all looking at the same time to get people on board. But in fact, I think in some ways, getting the right team together is about starting with looking at who you've got and reworking and rethinking through how that works, and then identifying what the gaps are. I understand why we are recruiting people to simply implement a programme that's funded for 3 years, but actually I think that the biggest issue is making sure we've got those workers, those staff in the longer term who are creating the links in the system. And so we really need to prioritise which staff we're aiming to recruit.
Yeah, I'd add to this and say that we certainly in the Royal College of Paediatrics and Child Health, and I'm seeing this on my own practice, I'm extremely worried about the children's workforce. I have to be very, very honest that we were incredibly disappointed in the NHS workforce plan. 92% increase for adult nurses, 0% for children's nurses. And children's nurses go on to do lots of different things. Once they've worked often in our hospital, they become the health visitors and the people out in the community, nurses that do a lot of this work. And we are struggling. Sometimes I go into my unit and there is only enough nurses to staff half of our intensive care beds. And that's a nursing crisis that. It's happening year on year. I don't know where this has come from, and this workforce plan, but I suspect, as I'm going to be really brutal here, too often over recent years we have seen sound initiatives, really good thinking, but with no thought for children and left behind until somebody says, hold on, what about the children? And it's very easy to understand. I have some sympathy with it because as with an elderly population, and I'm approaching it fast myself, you do start to get ill. Lots of elderly people, in fact, most of them have a chronic illness and a need, and it's huge, and it's a big problem. But we've taken the eye off the ball. We really have, and we need to put it back on. And I think family hubs are a great example of what can be done when you think proactively and you plan and you pull people together. Sadly, that hasn't happened for workforce, so I think it is going to be a pressure. And I certainly know of nurses who've left my hospital to work in a family hub, and are then struggling, our matrons are struggling to find people, to cover the shifts. And it's really tricky. It's really tricky and incredibly disappointing when we see this. So, of course, we're not going to give up, though. We're going to keep fighting for that. And, of course, you can't just think in silos, too. It's not just about children's nurses, children's doctors. We have to look at our workforce as a whole, our therapists, and there are many other workers who can support children as they go through illnesses or as they go through the ups and downs that life throws at them as well. So I think family hubs are a step in the right direction, but I think you've hit the nail on the head here. It's going to be tough if we don't also follow this with not only a workforce plan of some sort for children and young people, but a sort of training plan as well. Thank you.
Gentleman in the corner there.
Hi, I'm Stephen Kingdom from the Disabled Children's Partnership. We know that families with disabled children, the parental breakdown is a higher rate than other families, and we know that's a direct result of lack of support and lack of services. And only 1 in 5 families of disabled children tell us they get the support they need. And often when support is provided, it's inappropriate, so parents being sent on parenting courses that really aren't appropriate for their children and their children's needs. Or worse, it comes from a child protection lens, and parents, the great research by Leeds University into parental blame and institutionalised parental blame, where parents, their needs are assessed through a safeguarding lens. In a way, I mean, comparing with adults, if you need adult social care, you don't start with the assumption that the adult is at risk, but actually when disabled children, families are looking for social care support, services do actually approach them in that way. So we've actually got some optimism that family hubs may be part of the answers, but I'd really like to hear from the panel how family hubs will ensure that the right support is there and available for disabled children and their families.
That's a really interesting example that you give, and I think the first thing that comes to mind is that family hubs is about finding the right solution for the family and having that whole family approach. Creating a culture where you look at the family and you look at all the influences in the home and what's affecting the child, and rather than thinking what program can we pop this family on, actually thinking how can we actually achieve better outcomes for this child and the family. And so it brings us back down to just the core of the concept, really. And I think workforce training is so important here. We were talking just now about workforce, and I think those local authorities that have been delivering family hubs for a while, and those which are beginning to as well, are putting a lot of thought into workforce training, bringing cross-sector stakeholders together so that they can be trained together in understanding how you support families better, how you take a trauma-informed approach, how you really ask the right questions to understand what a family needs, and take an approach where they don't feel judged or criticised for what they're doing. So I would hope that the cultural change of family hubs will help families with disabled children where the pressure on parents is so much greater. So that will go some way. But the other thing is actually having that connectedness with the right services. And that's where we need to see local authorities really making sure that their job is not just about acquiring knowledge and information themselves, but ensuring that everybody in the network understands what is available locally, or at least providing ways for families, for practitioners to access that information. And the Department for Education is in the middle of a Growing Up Well project, which has developed some digital tools to help local authorities keep a record and make contact with the relevant services within the area and beyond. And I think that would probably help. I don't know if the Minister can explain or help any more on the Growing Up Well Fund and how that's going.
Well, I think what I was going to say is that it has to be taken in tandem with what we're doing on SEND reform. Because I was talking about this morning, but you will know this big battle that parents feel they have with the system to get the support their children should have. That support should often come a lot earlier than when it does come. If it did, some of those children would be able to get that support without any HCP. I mean, I'm telling you all the things you know, but these things have to be taken together. So part of what the SEND reform is doing is to make sure that children with special educational needs get that support earlier, that we have national standards for the support that's given, and that we have better trainings. I mean, advice and guidance for parents, to your point about family breakdown, yes, but also for staff in schools. If you look at the course we've done for primary schools, incredibly popular, this course. We ended up expanding it because there was such demand from schools to have that. And then I think you have to have it work well with family hubs like everything else, because they are the sort of shop front, if you like, for people to access all the sorts of services that they need. We won't fix the SEND system issues through family hubs, but hopefully what we're doing on the SEND system will be something that family hubs find easy to access.
So I was just going to add, actually, this boils down to holistic, person-centred planning as well. But my worry, being I think one of the charities on this panel, is also local authorities and those family hubs need to be engaging with the voluntary sector as well to see what provision there is out there. My concern is that they don't. Now, we are lucky as a charity that our local authority is engaging with us and we're engaging with others. But I also know that we know there are other organisations out there in the voluntary sector that are not being engaged with. So I think there's a conversation and dialogue to be had with your local community and making sure that all local voluntary sector organisations are tapped into those conversations around person-centred planning and holistic planning as well. Otherwise, you could miss a resource that's going to be valuable.
I was just going to add as well, because it's a topic of passion that I have. There is an increasing number of children with complex medical problems. Our children's hospitals are becoming champion at looking after them and getting them through some of the most traumatic experiences you could ever wish to go through. And if you're a parent watching that, is incredibly difficult. And they come out the other end, and we've got to deal with them and try and support them as they leave hospitals and go into the community. That's where we want them to be. So the numbers are a problem, but it can be done. So a little example, some good stuff. A couple of examples of of things that can be done. So first of all, a few years ago, we realised with children who were spending a lot of time in hospital with complex care, we were running into conflict with their parents quite a lot. Sadly, every once in a while it breaks out so badly here in the news. It's not what anybody wants, and it causes a lot of problems. We realised, once we'd done some digging into this, there was multiple reasons for it. One of them was financial, because these parents were becoming an incredible financial burden. We made a deal with the Citizens Advice Bureau, and we invited to come into our children's hospital, and we employed them. We gave them money to come and sit in our children's hospital twice a week and do a ward round. They did a ward round, and over a year, they extracted out of the benefit system that wouldn't have been extracted £1 million for the parents of our children. It was phenomenal. We've carried it on. Of course, that's the power of a children's hospital. We have charity money. We were able to do that. Not every hospital is as fortunate as that. That led us to think more deeply about it, and we've now got a model of social prescribing, which we hope will also link to our family hubs. Again, it's been run off charities, where we've got key workers who are starting to connect across the North East and North Cumbria to know the resources out of the voluntary sector organisations, so that when children who've been through a traumatic experience and maybe need a lot of care when they go home, they have a lot of disabilities, that we can connect them smoothly, quickly, efficiently, so that there's a softer landing when they get out there. So I think there are things that can be done. How do you make it permanent, though? How do you systematise it? Again, I come back to family hubs. These could be fantastic resources of information in a gentle and compassionate way that help families land back into their community in a really positive way.
Thank you. We have time for two more questions. A lady here and a lady there. So, lady here.
Thank you very much. Lynn Perry, Chief Executive at Bernardo's, the children's charity. We are very supportive, of course, of the Family Hub's agenda, and I'm delighted to hear you highlight a couple of the areas where we are involved in Family Hub work, including Essex and the Isle of Wight. We did some cost-benefit analysis on our Isle of Wight Family Hub work, and for every £1 invested in the Family Hubs, there was a saving of £2.60. And over the course of a year, that equated to £1 million savings to the local authority. So I think it's very clear that there's both a fiscal and a human benefit from investing in family hubs. And whilst we welcome the opportunity for more to be created, of course, we would like to go further and faster, notwithstanding the things that people have said about workforce. Last night we hosted a reception with the 5 largest children's charities in the UK to call for change, and I just wanted to echo the point that Mike made about how important it is that children are at the heart of policy and the choices that we make about future investment. And we would really welcome the opportunity to speak to the Minister further about some of those calls, just want to share one final reflection and perhaps question for some feedback on. You know, we are talking here about integration in our communities. I think one of the things that I would urge is also thinking about how do we take every opportunity to join up thinking across government departments about investment in children and their future, including in family hubs. Thank you.
Joined up.
Yeah, I mean, look, I mean, firstly, happy to talk. Obviously, the Big Five talk to the department a lot. So, you know, I know we will have those. Conversations. The silo point, which you know a few people have made, I'm afraid this is endemic in government, and it was when I was running charities, and it's also nothing to do with children's policy. It's endemic to every area of policy because governments around the world, and it's not particular to the UK either. Governments around the world have departments that protect their turf, frankly, and there isn't much incentive to pool resources and pool expertise or have ministers roam into other departments. So we have had some successful interministerial groups here. Family Hubs actually is a good example of a policy, you know, involving the Department for Health, involving the Department for Levelling Up and so on. But there is an institutional problem in governments around the world that they do work in silos. And I agree with you, we want to break that down. But 'twas ever thus. People have been saying that for decades, I'm afraid.
Hi, Janet Fisher, Chief Executive, Live Music Now. We're a national music and health charity, and we work in 20% of the special schools in the country. How, given that we've talked about what Nav has said, and that this joined-up way of working is so important, how is it that the Family Hub network can facilitate those charities, and let's please drop the voluntary sector title, we're not volunteers, how can we actually start facilitating that ability to work at scale? Our colleagues in the Big Five are super generous across the line. We're all after the same outcomes for children and young people. How do we make sure that the capacity in our charity sector is actually amplified by the work that's going on in the family hubs, that we're able to connect in? Because there's some amazing work going on the ground, but we in charities don't often have a lot of extra capacity to be able to come in. So, you know, we and many other arts charities, for example, could be working in a cross-lateral way across all of the family hubs, but we don't have the resources to be able to be making new connections with 42 ICBs and 75 family hubs because we're busy already oversubscribed in the work that we do. So how is it that we can sort of take a bit more of a strategic approach to including the third sector as part of this process?
Shall I go? I'll go for. I'll just quick one on just in practical examples. I think it's probably hard to do at really big scale nationally, but maybe it can be done. But the examples I have in the northeast are very much by knowing your network, knowing who's there, and creating a relationship. Something about relationships and actually knowing people from different charity organisations or from health or from educational organisations, and being able to work together. It's a strange experience watching a project grow that involves people who've not worked together before, and building those relationships and watching over 6 months, a year, and it to grow into something that you never would have dreamed of. So the example for me was my Middlesbrough kids who are now having holiday sort of lessons from some of the top dance instructors that we have in the north of England. Just would have never happened before because people from Middlesbrough don't go and watch the ballet. Now, they're not doing ballet, they're doing movement, they're doing dance, they're doing lots of different things. And it's making them also have a conversation while they're there too. So I think that project grew out of a partnership. The funding came separately, and I think I have sympathy with the charity sector because often you're on this short-term funding. It was a project for 3 years. What happens after 3 years? And I think that's a real challenge. But at least we've done it, and we've established the principle we can do this. So I think it's something about knowing those relationships at local scale is really important to sort of giving this a go. not really answered your question about how you sustain it, and how I don't know how you sustain it, but I think it can be done.
I think it's such an interesting question. We find you say that you organisations haven't got the time. Well, I think local councils would say to you, we don't have the time either. And what you've got is people with not enough capacity to be able to spend time investing in relationships. And I've come back to Lancashire again, actually, because what Lancashire is doing to encourage engagement from the voluntary sector is what do they say it? What's the phrase you're using? It's working out in the open. So what they've done is they've created a platform where anyone who's interested in their family hubs and wants to take part can log in and become part of the conversation. And so the Lancashire County Council is not taking responsibility for keeping everybody updated, but is saying, come on, join us, be part of it. I mean, I think you're raising a really good point that we are encouraging local authorities to engage with the voluntary sector from the first, but there can be a tendency to say, oh, we'll do that when we've got everything else going. But actually, if you really want to increase capacity, you need to do it from the start. So we need to make those noises. I think using local infrastructural voluntary sector organisations is a great way to help reach everyone, to build that sense of community. I think the other thing we see where it's working well is where local authority and voluntary sector organisations work together to get funding, because often the voluntary sector organisation is eligible for funding, but the local authority isn't. And so they come together, and that's working really well in several local authorities. And the last point I'd make is that councils have strategic visions, and they know what their priorities are. And a great way for family hub networks to make an impact and to stay relevant locally is to demonstrate how, through working together through family hub networks, they are impacting the local needs that have been identified by the council. So that's the way we're seeing it working. That's not a great answer for national organisations, but that's how we're seeing it on a local level.
Thank you, Catherine. Well, I think we have to draw to a close there, slightly run over our Q&A time. But I think it's been a really challenging, informative, wide-ranging debate on family hubs. And I hope you've all been challenged by it and educated through it. I certainly have. It's been very interesting. And I must thank the Minister for being with us, and for Dr. McKean and for Nav and for Catherine for their various skills and areas of wisdom, and I think it's been very good. And thank you all for coming. Thanks for some great questions. I just encourage you to go away and continually think family hubs. Sorry, I'm being whistled at.
Very simply, there's a QR code on your leaflets, the Family Hub Network leaflet, if you want to go to our website and find out more. Sophie, who's been an amazing camera woman, has got a sign-up sheet if you'd like to learn more, or just stay in touch with the Family Hubs Network. But thank you so much, everyone, for coming.